Hello everyone, my name is Anthony Ortiz, and if you remember my last speech, I spoke of the harmful side effects of the antidepressant drugs known as SSRI'S, which include Prozac, Paxil, Zoloft, Wellbutrin, Effexor, and Lovix, just to name a few. Adverse reactions include suicidal and homicidal ideation, mania, restlessness, irritability, hostility, and akathisia are just a few of these reactions. I also shared with you my own personal experience when I found the bodies of my girlfriend's twin 3-year-old sons that she shot and killed during an adverse reaction to these drugs. Today I am here to reveal to you the true monsters behind these mind-altering drugs. The drug companies themselves. Eli Lilly and GlaxoSmithKline are among the major suppliers of these drugs. Eli Lilly, the makers of Prozac's continued silence concerning all the questions surrounding Prozac is beginning to ring loudly in the ears of the public. Why did they not disclose the information they already had on the link between their product and violence and suicide long before Harvard's Dr. Martin Techer had his test results published? Why have they not warned doctors, pharmacists, or patients about their own study published a couple of years ago, which shows that Prozac clearly multiplies by tenfold or greater many other drugs? Why are they now even ignoring all the allegations of the horrible emotional and physical side effects associated with Prozac while they continue to defend its safety? They continue to stress that these problems are appearing only in a very small number of patients. Let's say that the side effect suicide occurs only in 1% of the 2 million people now taking this drug. Is it okay to throw away 20,000 lives down the drain to keep some people from feeling a little down? If we look at current figures, we find that according to Eli Lilly, there are now 9 million prescriptions which have been filled for Prozac alone. Dr. Techer's reports indicate adverse reaction of suicidal homicidal ideation in his study to be anywhere from 3 to 8%. That means that the number of patients we're talking about would be between 270,000 to 720,000. If we use their 1 out of 7 figure, or approximately 15%, we're looking at an astounding figure of 1,375,000 patients. 750,000 patients experiencing the most serious of Prozac's adverse reaction. Adverse reactions which affect not only the patients but all of society. It is unfortunate that many victims and their families will remain unaware of the cause of damage they have suffered. Eli Lilly is currently being investigated by a federal grand jury in Maryland to see if they are complying with government regulations on drug manufacturing. After a 4-year inspection, the FDA has found Lilly's submitted data to be inaccurate or incomplete in nearly every system inspected. The FDA reported that even though they were told they had received complete information on the matter, they found later that other records were withheld. I already mentioned unreported side effects including psychosis and death associated with SSRIs before Lilly obtained FDA approval to market Prozac. How many of us feel the FDA is our protector against harmful substances? How many of us falsely believe that the FDA tests drugs, then approves them when in actuality, the pharmaceutical companies making these drugs are the ones who handle the testing? Then they submit their research to the FDA for approval. If those drug companies are not completely thorough, open, and honest in their reportings, then where is that protection that we all feel confident about? The law requires that drugs be tested before approval to make sure they are safe and have the desired therapeutic result. Yet the majority of this research is conducted by doctors at academic medical centers and paid for by pharmaceutical companies. Let's look at the cost of drugs today. Prozac alone is bringing in over 100 million per month for Lilly. These are the largest for-profit companies in the business world. Their main focus, profit, profit, profit. In 1992, Consumer Reports tells us the pharmaceutical industry has long been the nation's most profitable. The top U.S. drug companies averaged 16% profit of sales in 1990, more than triple that of the average Fortune 500 company. It is appalling how very little known within the entire community about the effects of the illegal mind-altering drugs. But even more appalling is the ignorance regarding the legal mind-altering drugs when it comes to their powerful intoxicating effects and the strong impact they have to alter one's behavior. I'd like to leave with you this last note. Society becomes a laboratory when a drug is not adequately tested before marketing. Thank you for listening.